Having health insurance is very important, but at certain times in our lives it may seem completely unfeasible. Luckily, there is help. Some individuals are what's known as dual eligible for both Medicaid and Medicare. Hi there, my name is Sarah, and I'm here today with iHealth Brokers to discuss all about dual eligibility plans, also known as DSNPs. Many individuals who rely on Medicare for their health insurance still find themselves struggling to meet their monthly premiums and copays. If your income is below a certain level and you meet certain criteria, you may be eligible for Medicaid in addition to Medicare. These types of plans are known as dual eligibility special needs plans, or DSNPs. So first you need to determine that you do in fact meet the criteria, and then you can select one of these DSNPs based on your location and your specific needs. Because these types of plans are offered by private carriers, we highly recommend that you work with a licensed broker. A broker will serve on your behalf, not the insurance companies, to make sure that you find the best possible plan at the lowest possible rate for your specific needs. Now, if you need any help, you can reach us here at iHealth Brokers at 888-410-0344. There is, of course, no charge for our services, but we will make the whole process a lot easier. And even if you find out that you are ineligible for a DSNP, at least we can help guide you towards a plan that may be more financially feasible for you. DSNPs are a type of Medicare Advantage plan, also known as Medicare Part C. Medicare Part C plans encapsulate all the benefits of Medicare Part A, which is your hospital insurance, Medicare Part B, which is your outpatient insurance, and Medicare Part D, which is, of course, your prescription drug insurance. Now, since you are eligible for both Medicaid and Medicare, you retain all the benefits of both programs, and there is a lot of overlap. If you want to learn exactly what the benefits provided by Medicare A, B, C, and D are, you can check out one of our other videos. I'll put the links in the description below. And we also have a video all about the benefits of Medicaid. Dual eligibility plans offer the full benefits of Medicaid, Medicare Advantage, and some more benefits thrown in for good measure. Medicaid is a program that is jointly funded by the federal government and the individual states. The individual states have a modicum of control over the type, the amount, and the duration of the benefits, but they have to meet certain federal guidelines. So states can choose to offer better benefits, but they have to meet those guidelines. Medicare Advantage is a program that replaces original Medicare, which is Medicare Parts A and B, entirely, and also encapsulates Medicare Part D, which is prescription drug coverage. With a dual eligibility plan, you have benefits such as inpatient procedures, outpatient procedures, nursing care in both facilities and at home, hospice, preventative services, mental health services, medical equipment, prescription drug coverage, dental, vision, hearing, and more. The list really is quite extensive. Additionally, DSNPs offer other benefits, things like transportation to and from appointments, richer dental benefits, and some plans even offer meal services after procedures. Because these types of plans are offered by private carriers, they do offer different benefits, and those benefits can vary quite widely, and they do so to compete for your business. Because of that, we really recommend working with a licensed broker. That way you find the right plan for you. To be considered dually eligible, you must be eligible for both Medicaid and Medicare. Eligibility for Medicaid is determined by a series of factors, largely income, household size, and your state's individual criteria. Generally speaking, you're eligible for Medicaid if you make less than 100% to 200% of the federal poverty level and are pregnant, elderly, disabled, or a parent or caretaker of a child. If you make less than 133% of the federal poverty level, or FPL, it's still possible that there is a program for you, but it really just depends upon your state. Additionally, to be eligible for Medicaid, you have to meet certain non-financial criteria. For example, you have to be either a U.S. citizen or a permanent legal resident. You have to reside in the state in which you are claiming benefits, and sometimes there are additional criteria for specific groups based on pregnancy or parenting status. Now, there is something else that many states have adopted, which is known as a medically needy program. This is designed to help individuals who might be ordinarily disqualified for Medicaid based on their income alone, but who have health needs that are so extensive that they're able to spend down their income to then qualify for Medicaid. I know eligibility for Medicaid can be a little bit tricky and confusing, so if you have any questions, just leave a comment below and we will be happy to help. And you can also log on to medicaid.gov, that's medicaid.gov, for additional resources. Now, since we're talking about dual eligibility plans, and like I said, you have to be eligible for both Medicaid and Medicare, you must also be eligible for Medicare. You're eligible for Medicare if you're over 65 and a U.S. citizen, or you're over 65 and a permanent legal resident who's lived in the United States for at least 5 years. You're receiving Social Security or railroad retirement benefits, or you've worked long enough, that is to say 40 quarters, to be eligible for those benefits, even if you're not collecting them just yet. You're also eligible if you're over 65 and you or your spouse is a government employee or retiree who has not paid into Social Security, but who has paid into Medicare payroll taxes while working, meaning a Medicare-covered job. Now, if you're under 65, you're also eligible for Medicare if you've received Social Security benefits for at least 24 months. These months don't have to be continuous, there can be gaps, but it has to be at least 24 months. You're also eligible if you're under 65 if you have ALS, and as of 2021, you'll be eligible if you have end-stage renal disease. In order to enroll in a DSNP, you'll first need to provide documentation. You'll need to present your Medicaid card, but if you haven't yet enrolled in Medicaid but you believe yourself to be eligible, just contact your local Medicaid office or log on to medicaid.gov, that's medicaid.gov. Once you've done that, you have the option to enroll during your individual open enrollment period, which is the 3 months before you turn 65, the month of your 65th birthday, and the 3 months after. Or you can enroll during the annual enrollment period. This is every year from October 15th to December 7th, and during this time you have the option to join a plan, or switch a plan, or drop a plan. Now, remember that DSNPs are part of Medicare Advantage, which means you need to make sure that the hospitals and doctors that you wish to use are in network, because most DSNPs operate as HMOs, although there are a few PPO options. That also means that you'll need to select a primary care physician, or PCP. When you want to actually enroll in one of these DSNPs, you have the option to log on to medicare.gov, that's medicare.gov, and access the plan finder. Or you can contact the carrier directly and work with an agent, not something we recommend because that sort of limits your options. Or our number one recommendation, you can work with a licensed broker. The costs for a dual eligibility special needs plan vary dependent upon your level of need and your state. Now, even though the benefits are regulated by Medicare, the costs, meaning the copays and the monthly premiums, are determined by your carrier. You may be required to continue to pay for Medicare Part B in addition to another monthly premium, or not at all. Regardless, if a DSNP is an option for you, we highly recommend that you pursue it because you'll have all the benefits of Medicaid, plus Medicare, plus a few more thrown in, and generally speaking, there are cost-saving benefits as well. So if it's an option for you, it really is a good option to pursue. I hope this video has answered all of your questions, but if you have more, just leave a comment below or give us a call at 888-410-0344. We are licensed in all 50 states and with over 200 carriers, so no matter where you are or what your question, we can help. If you liked today's video, make sure to click like and subscribe as well to stay up to date on all things health insurance. And if there are any other videos you'd like to see, let us know in the comments so we can get on it. Thank you so much and have a great day. Bye-bye.